Good morning. This is Action News Jax Sunday.
Good morning. It's Sunday, March 31st, 2019. Welcome to Action News Jax Sunday. I'm Paige Kelton. The opioid epidemic continues to claim lives across the country and in our area. There's a better than average chance that either you or someone you know has been impacted. This month, the Centers for Disease Control and Prevention released a detailed study of who is dying of this epidemic. The research tells us men are 3 times more likely to die. Researchers say overdose deaths are also increasing faster among Black and Hispanic Americans than among whites. There's an especially steep rise in the number of young adults, ages 25 to 34, whose death certificates include some version of the drug fentanyl. This week, we also learned how states are spending billions of dollars to address the opioid crisis. A first-of-its-kind report from the Bipartisan Policy Center tracked $11 billion federal dollars spent fighting opioids in 2017 and 18. Florida received more than $500 million in that time. The report suggests federal resources need to be more reliable, and states need to ensure money for treatment is being used for facilities that are proven to work.
We found more than 50 different federal programs and funding streams, all going to states and localities, covering areas such as prevention, treatment and recovery, law enforcement, interdiction, criminal justice.
It's too early to know if the money is making an impact. There are signs, though, of a slowdown in this epidemic, but its end is still nowhere in sight. Experts say we're also now seeing the third wave of the epidemic. It began with the overprescription of painkillers like OxyContin. When police and lawmakers cracked down on pill mills, drug abusers went to the streets, fueling a resurgence in heroin use. Today, synthetic fentanyl has surpassed heroin, becoming America's deadliest drug. The DEA says it's made in China, packaged in Mexico, and then smuggled here into the U.S. Joining me this morning is someone who is on the front lines of this epidemic, Dr. Christine Caulfield, CEO and licensed clinical psychologist at Lutheran Services Florida Health Systems. Thanks for being with us this morning.
Oh, my pleasure.
The evolution of this epidemic, because that's what it has been. When one drug gets tougher to find, another stronger drug emerges. As lawmakers crack down on one facet of this, something else always develops.
Yes.
How do we fight a war where the battle and even the battlefield changes so much?
You know, it's very, very challenging, to say the least. And we are in the front lines at LSF Health Systems, working with our providers and our network of care to find the magic bullet, if you will, that really addresses and helps people move forward in their recovery.
There have been changes in the law, for instance, the 3-day rule now with certain narcotics, opioids, only can be prescribed 3 days at a time.
Yes.
Are you seeing that make an impact, or are the people who are dedicated to get these drugs, are they still able to get them on the black market?
What we're finding is people are finding a way to get them on the streets, and that's so dangerous because, as you say, the third wave is fentanyl, the deadly ingredient that is killing people, more potent than heroin, 50 times more potent, and more deaths than the HIV crisis, car crashes, and even with gun violence.
And I've talked to doctors on the front lines. The fentanyl, it is so frightening because there are varying formulas, stronger and stronger formulas coming out. We've Project Save Lives locally, the testing that's being done, and it's being found mixed in so many different things. Now we're seeing it mixed with cocaine. We're seeing, I knew a young woman who passed away because marijuana had been laced with fentanyl.
Yes.
It's in places that people don't even know that that's what they're ingesting.
That's right, and it's so dangerous because you can't smell it, you can't see it, so you have no idea the drug that you're taking is laced with this, and so people are dying daily.
Now, who is dying? The CDC data, new data, is saying that men and African and Latino Americans are overdosing and dying at a higher rate than other demographics. What does that tell us?
You know, it's a new trend. It used to be pretty much middle-aged white males were the predominant victims, if you will. But
and
we
now
are
the
seeing
demographics are younger. It's
they are
25 to...
younger, and they are changing in the demographics, as you say, with the African American and Hispanic populations really on the rise.
I know it's hard to ask, but is there a typical user? I mean, these are the functional members of our society who are becoming hooked. I mean, I know it's a spectrum of users, but who is the typical user?
You know, what we see at LSF Health Systems are individuals that sustained an injury, perhaps an on-the-job injury, perhaps a car accident, some type of fracture. They went to the emergency room, they were prescribed oxycodone, OxyContin, then followed up with their doctor who continued prescribing more. And you know, it only takes 2 weeks to get really hooked on the strong effects of this very addictive drug.
They've talked about teenagers too going to get their wisdom teeth out and some of them becoming addicted.
Precisely, yes.
That's frightening.
It really is. And another frightening aspect of this is that people are so hooked that they're reporting that thefts in households are mainly through the medicine cabinets. People are breaking in and stealing prescription drugs.
According to the state of Florida, our area leads the state in synthetic opioid and heroin deaths. What is fueling those numbers here, and our intervention and treatment resources keeping up with demand?
Yes, it's quite challenging. Florida is 50th in the nation, unfortunately, for funding for behavioral health care services, including substance abuse and fighting the opioid epidemic. I will say that we've had champions in the legislature that recognize this issue and are funneling dollars to specifically handle this crisis. What we're also finding is that the use of certified recovery peer specialists are key to be part of the treatment milieu. They are key in motivating individuals that are revived from an overdose to seek help.
These peer specialists, we talked about them, Project Save Lives.
Yes.
Locally, people who have, in most cases, been through this situation themselves, recovered, and are now helping others do it, going out into the ERs, the immediate intervention. How is that ground level approach? At least in Jacksonville, Project Save Lives has been incredibly successful. But is that the approach that really needs to be taken? You know, no matter where you are?
We fund part of that project at LSF Health Systems, and we're finding that not only do other cities in the state of Florida want to emulate what we're doing, but we're getting national attention. It really is working. And again, the linchpin is the certified peer specialist, someone that has walked the walk and is able to talk heart to heart, if you will, to that individual that has been revived from an overdose status. And again, motivating them, staying with them, and helping them move into a recovery status.
Where do we go from here? What still needs to be done at the ground level?
That's a great question. We certainly need more funding. We still have waiting lists. We're finding, though, that there's some very effective treatments. Methadone treatment is very effective. Buprenorphine is proven to really reduce those cravings and help people remain stable and in the community. So we do have answers. We just need additional funding so that we don't have waiting lists and we get people the help that they desperately need.
Dr. Caulfield, thank you so much for joining us. We appreciate it.
My pleasure.